All right, we are live, but you might notice today we are only live on X. The purpose of only going live on X will become obvious in just moments because I'm very excited about today's episode. We have a CDC insider with us today to talk about everything that has happened at HHS over the past weekend. And what's happened over the past weekend isn't really just what's happened over the past weekend when 4 high-ranking CDC officials, some of them quit. One of them was fired, although she tried not to leave. This has been a long time coming. And what's happening inside of HHS and CDC right now, at this very moment, is what you voted for. It's finally happening. Now, it's almost hard to know where to start today. We're going to bring our guest on in just a moment here, but I want to start with President Trump's post on Truth Social about the COVID vaccine. Now, the context of this, of course, is President Trump has always been very proud of the COVID mRNA vaccine. He's bragged about it. He's always stuck by it, even in the face of our criticism. The only evidence that you and I have ever seen of Donald Trump questioning the COVID vax is the story that John Rich, country singer John Rich, tells about having dinner with President Trump. And President Trump turning to him during dinner and saying, "John, why at my rallies, whenever I bring up the COVID vaccine, do my crowds boo?" And he asked this actually curious about what the answer is. And John Rich told President Trump, "Mr. President, because every person at that rally knows someone who was harmed by that vaccine." And when I heard this story, when I heard John Rich tell this story, I thought, this is one of the characteristics of Donald Trump that I admire and respect the most. His curiosity. He's not dogmatically tied to things, even if he's proud of them. And that was evidenced by, I've never heard the president talk like this or post like this before. Over the weekend, Donald Trump posted on Truth Social and said, and I quote, "It is very important that the drug companies justify the success of their various COVID drugs. Many people think they are a miracle that saved millions of lives. Others disagree. With CDC being ripped apart over this question, I want the answer, and I want it now. I've been shown information from Pfizer and others that's extraordinary, but they never seem to show those results to the public. Why not? They go off to the next hunt and let everyone rip themselves apart, including Bobby Kennedy Jr. and the CDC, trying to figure out the success or failure of the drug company's COVID work. They show me great numbers and results, but they don't seem to be showing them to many others. I want them to show them now to CDC and the public and clear up this mess one way or the other." President Trump says, "I hope Operation Warp Speed was as brilliant as many say it was. If not, we all want to know about it and why. Thank you for your attention to this very important matter, President DJT." When I read this post, I had to verify it to make sure that it was real, because I have never heard the president question the COVID vax in the way that he did in this post, actually saying, "I'm going to follow the evidence and the data where it leads me. I'm not coming to this," even though he admitted he favors a certain outcome, he's not going to let his personal bias impact the conclusion he draws about this vaccine. To call this, and I know that critics of President Trump will laugh at the idea of applying the word humility to Trump. "Oh, he's an egotist, they tell us. He likes the sound of his own voice." Listen, I have never seen such tremendous humility from such a powerful person as I saw in this post from President Trump. I have so much respect for this man. So much respect for this man. Read this post again. You do not love President Trump enough after all this time to say, actually, let's investigate this question for real. Give me the numbers. Let's find the answer. Let's find the answer. So we have with us today a very important guest. He is a physician. He is a scientist. He's an author. He's a medical advisor to MAHA Action. He is also an insider at the CDC. He is a member of the Advisory Committee on Immunization Practices, that would be ACIP, a very powerful committee that helps determine whether vaccines are approved or not approved, who they are recommended for, and whether they are allowed on the market at all. That would be Dr. Robert Malone. Dr. Malone, thank you for joining us today.
It's an interesting time to be involved in this sector. And it certainly over the weekend was a lot of activity on social media, let's say. And I'm reminded once again, as I posted in one of the Streisand effect, the I don't know that those that resigned so vocally and wrote their letters from the CDC anticipated the level of scrutiny that they and their former agency were going to encounter in the context of, in particular, one of the individuals' press tour and the New York Times op-ed from former CDC officials, notably not including the uh, preceding director during the COVID crisis under Donald Trump. It's we're in public health. I don't think that we've ever had a period of time, a window of time in which the underlying culture and a lot of the established conceptions of particularly the vaccine sector were being challenged so actively. And it was, you point out President Trump's post, I think that dropped yesterday, didn't it? Yeah. So, and I was one of the early adopters of reposting that from Truth Social, but that that just extended the press cycle that's been going on now for, was it 4 days?
Yeah.
Concerning all of this brouhaha. And a lot of people don't recognize that the kickoff for this was the quote protest and walkout by a small number of CDC staff, actually. Most of the people that were in that walkout or protest were actually those that had been terminated under Doge, but then filed legal appeal and extended their period of, it wasn't even work at home, furlough, paid furlough that they had for a couple of months. And then, of course, we had the young person that unfortunately decided to shoot up the CDC and killed a security policeman that was responding to his threat, a father of, I think, 2 children, a great tragedy. And then we had this protest that was largely of those that had been doged, made redundant, lost their court case, were no longer employed, joined by a few people from the CDC, and then this inexplicable departure, first documented by Stat News, as I recall, of senior officials, including the chief medical officer from the CDC, that had resigned. Ostensibly, their justification is because of, quote, political interference from the secretary of HHS. That's been the approved narrative. But the immediate predecessors to those resignations were twofold. Number one, I believe it was Monday of last week, the nominated and confirmed director of the Centers for Disease Control and Prevention, Susan Monterez, who apparently had the endorsement of Senator Cassidy, who has been a very vocal critic of Bobby Kennedy and also has close ties to the new RNA industry lobbying organization. I understand that Senator Cassidy does not intend to run for another term. So this is kind of his grand exit.
What are his ties to the mRNA lobby?
Pardon?
What are Senator Cassidy's ties to the mRNA lobby?
So I actually was the first person to really document this and dig into it. You can find it in our Substack. All the information about the RNA lobby that's been formed. It's a classic K Street operation. And they had a slide deck with a series of images that they were basically promoting to their members to show them how effective they're being on the Hill that prominently included photographs of a key meeting with the senator. So basically, it was kind of a self-own where the new RNA lobby organization was showing their members that they have this good, close working relationship with Senator Cassidy. And you can find all those details and the documentation and the links, etc. This isn't a conspiracy theory. Well documented. As I said, it's a cell phone in our Substack. If you go look there.
I think that's what you call we've all heard of proof of life photos. I think that's what you call proof of capture photo.
What?
Proof of industry capture.
So Senator Cassidy and Grassley and many others are now calling for Bobby's resignation because of the narrative, the promoted narrative. And it must have been hundreds of articles over the weekend from corporate media and kind of the second and third, fourth tier media allies that promoted this narrative that Bobby has been politically interfering in the CDC, consequent to his meeting with Susan Monterez on Monday, in which I infer, I don't know first person, I haven't talked to Bobby about what happened, or Stephanie Spears or anybody else, up in that upper echelon of what transpired, but the reporting has been, so this is public information, not private, confidential. The reporting has been that there was a meeting in which the secretary asked the director of the CDC to, how do I say this? I'll just say it, fire some people that have been slow walking and otherwise obstructing various aspects, in particular of the ACIP. Well, what was it in specific that they were obstructing? It was these terms of reference, is the technical language. How they came up with that, I have no idea, but it's basically the scope of work for what the ACIP subcommittee on coronavirus vaccines is going to take on. And I helped write that. Retzef Levy has posted about this. He did an excellent interview with Marianne Damasi that is on Substack. I recommend to you, but unfortunately it's behind a paywall. Marianne has to make her buck just like you do. And so unfortunately, I wish I've asked Marianne if I could please republish it openly, because it's so important to listen to what Retzef says, because it completely contradicts this narrative of Bobby's political interference. What has happened is that the ACIP subcommittee for coronavirus has met, and with Jim Pagano, myself, and Retzef Levy is the chair. Retzef is a full professor at MIT whose focus is on risk analysis and risk mitigation, and has written extensively during the COVID crisis concerning the risks associated with the vaccines, particularly the mRNA products, not so much the adenovirus products, which are no longer on the market anyhow. I don't think he said a peep about the Novavax product, just to be clear on that. But he is eminently qualified. But the narrative that's been promoted is that basically, and without naming names of those that have been involved in the obstructionism, that the CDC career staff has historically and should continue to have a key role in defining the scope of what the ACIP considers as it develops its advice to the director of CDC. And Liz, let me just walk that back for a moment. ACIP is constituted under the structure of what's called the FACA legislation, Federal Advisory Committee Act. And so ACIP is a FACA committee, And the congressional intent there is that it would create a structure that would advise key political appointees within the bureaucratic administrative structure. We call it the administrative state or whatever. So the people that the president appointed and those that they appoint would be advised under FACA by these independent committees of experts that would assess what is going on in that part of the bureaucracy. And in this case, it has to do with vaccine policy, and would provide that advice to the responsible federal individual, in this case, the director of the CDC. So in theory, the ACIP, you talk to them, as you mentioned them in your lead-in, as a powerful committee.
Yeah.
They've had a bit of mission creep, in my opinion, and they have become perceived as being much more powerful than they really statutory-wise should be, because the ACIP does not set the policy. The ACIP advises the director of the CDC, who can accept their advice or reject their advice.
How often does the CDC director accept or reject? Like, is it typical that the advice given by the ACIP is accepted by the CDC director, or is it what percentage?
Almost always, but notably during COVID is just one example. There was a point in which the prior ACIP committee, the one that Bobby retired because of the chronic conflict of interest, let's say, and extremely close relationship to the various professional societies that have virtually all been, I'll say, purchased by the pharmaceutical industry over time. Notoriously, the AAP, the American Academy of Pediatrics. But so Bobby retired all those, but even under that prior committee, there was an advice to Rochelle Walensky that these products should not be recommended for all children.
Yeah, I remember that.
And she rejected that advice, overruled it, and made the unilateral decision that she believed that they should be deployed for all children. And that was part of the justification. Back then, some very strange things happened. The second tier union of teachers actively lobbied the CDC for a series of policies, and the CDC actually changed policy position in response to that advocacy concerning lockdowns for children and masking of children, which we now know in retrospect were incredibly destructive in terms of education for children and basic things like their, for the small child, their ability to read lips and interact with people, a key part of learning speech, proper speech. So Walensky, I don't think that there was a study done by the Senior Executive Service that you may or may not recall. It was covered in the New York Times that criticized Rochelle Walensky and the decisions being made in the management at CDC through the COVID crisis. And at that point, she was basically sidelined under the Bush administration. And what you had was the Senior Executive Service, otherwise known as the deepest of the deep states, step in to manage the CDC. So that's kind of the historic context. The ACIP doesn't always get its way. But one thing that it has that makes it a little more than just a FACA committee is that Congress passed this Childhood Vaccine Act, in which, for all the right reasons, they decided that there would be subsidies for ensuring vaccine equity and access for poor and indigent populations, including, of course, the Indian Health Service. And so the ACIP advises also as to whether or not a vaccine product should be included in the Vaccines for Children program. And as soon as the ACIP, and I don't think this even requires the director to approve, but if the ACIP, I guess I'll say with the director because I'm not sure about that, gray zone, decides that a vaccine should be included in the Vaccines for Children program, there's an automatic purchase and distribution throughout the United States of that product. And furthermore, it because it carries the weight of the federal government promoting this particular vaccine, distributing this vaccine, purchasing this vaccine for this category of children, it becomes, and here's the key, standard of care.
Yeah.
And once standard of care is established, then any pediatrician that varies from that standard of care, like for instance, if you have children, I don't know about you, but let's say your audience, members of your audience have children, and they wish to take their children to school, to a public school, they're more than likely going to be confronting the question, well, where's your vaccine records for little Jimmy? And when they take Jimmy to their pediatrician, increasingly pediatricians throughout the United States will basically say, is Jimmy up on his vaccines? And if the answer is, well, no, I thought that I really didn't want to have all those jabs in that tight schedule for my child because I thought it was not good practice and it might cause inflammation and potentially brain swelling and other things. For whatever reason, if some parent had decided that they didn't want to stick with the vaccine schedule and prolong it, many pediatricians will basically fire their patients.
Yeah. I've had a lot of friends who've dealt with this.
Yeah. Well, the new one, Liz, that's even a little more insidious and has absolutely no literature to support it, is this new policy of grandparent vaccines, where grandparents are being told, for instance, they can't come into the hospital and visit the newborn unless they're up on certain vaccines. Now, there's absolutely no literature to support that. There's no ACIP policy to support that. It's just being promulgated throughout the hospital system as kind of a standard policy. But it all comes down to standard of care. And if you're a practicing pediatrician, let's say you're acting in good faith. It's not just that you are incentivized in various ways. You're acting in good faith, but you have a patient come to you, the child, and they're not up on their vaccine schedule. Well, if you don't document that you have advised mother and father that the child is not up on the recommended standard of care for vaccination, then you have legal liability issues in the instance that that child happens to develop, let's say they weren't vaccinated for measles, taking a recent case that is sensitive in Texas. And so you are placing yourself at legal risk.
Yeah.
And that's the way the system works. And it all flows from the federal policy that gets established at CDC via ACIP about standard of care and then gets reinforced and amplified through the various professional societies and through the Vaccines for Children program. The other nuance of the VFC program is if you're a manufacturer and you get your product into the Vaccine for Children program, then you get the golden calf. You get indemnification, which means you can't be sued. And so your product has, if you think it through as a business, okay, talk about the ultimate cash cow. You get a single point of purchase being purchased by the federal government. So you got a single customer buying a large amount of product, and it is marketing that product often through legal mandates. It is absolving you of any liability for that product, and it is managing your distribution. What's not to like? If you're Pfizer or Merck or
if you're a bad person, it makes sense that they spend all the money they do lobbying politicians. If you have zero morals and zero care about your fellow human beings, then it makes perfect sense. Listen,
if you're, and this is the nature of modern pharma, is they really don't give a about the likes of you and I.
Yeah.
It's all about ROI, return on investment, market cap, revenue, profit, and market share. Yeah. And it's none of it is about serving. They couch it in the nice language. Oh, you can watch their advertisements, butterflies and rainbows. But that is not the case. And by the way, Liz, it's even worse in the veterinary sector.
In the veterinary, I don't own a dog myself. I have heard about this. This would actually be an interesting topic for another episode. But let me tell you, when I declined a vaccine for one of my young children, this is several years ago, the pediatrician at the time that I was taking my children to tried to get me to sign a document that said that I was aware that by declining this vaccine, I was putting my child in harm's way. That's how these pediatricians, when they are strangled by standards of care, and listen, I'm sure there's good pediatricians out there. I don't want to generalize them all, but there is a stereotype of pediatricians that they are not just, I'm sorry, we have to practice by the standard of care. They actively, as individuals, are coercive. I refuse to sign the document. I fired the guy.
This is reinforced in medical school.
Yeah.
There is a culture, and it really has earned the name of the term being a cabal.
Yeah.
There is a culture, an obsessive culture of vaccination. And let's be real here. Vaccines are just another pharmaceutical. That's all they are. They are not a magic bullet that cures all infectious disease. Influenza vaccination is something like less than 50% effective. Sometimes it's almost down in the single digits.
Didn't it have negative efficacy this year?
Well put. You are informed. So some studies, how could you have negative efficacy? And stay tuned.
That came out of the Mayo Clinic, by the way. That wasn't just somebody's blog somewhere on the internet.
They don't know what they're talking about. The ACIP are the only experts that can say anything about this. And that is the core issue here.
Listen, this was the point that I was making at the beginning about ACIP. This is a very powerful committee, whether or not legislatively it was intended to be. I mean, when you told me Rochelle Walensky during COVID was one of the only CDC directors ever to reject a recommendation from the ACIP, that tells you how much power this committee has. And it kind of brings me back to the point.
Liz, it's the appearance of power. And this gets to exactly the whole brouhaha that's happening right now.
Yeah.
With the interviews, I'm not going to name names of the gentleman.
Dr. Dimitri, we know who you're talking about, the gay Satanist guy.
Yeah, Satanism. As I said, maybe in the future, we should recognize that sadomasochism is not the thing that you want to have as a fundamental cultural belief in a U.S. government public health official setting vaccine policy. Just seems like common sense to me. If you know anything about sadomasochism, if that's where you want to be, God bless you. But I really don't think you should be involved in setting public health policy personally, if that's your culture.
Oh, yeah. I mean, these people should be nowhere near children. We shouldn't be taking their advice about children. And you say God bless them. I say I think God needs to exorcise them. Thank goodness they're not.
Term that came up in a discussion in our subcommittee the other day. And maybe to some extent that's happened, but you could say that. I wouldn't. But that what we're dealing with is a deeply embedded policy that the CDC are the experts, despite the fact that their various documents and pronouncements are never subjected to peer review.
Yeah.
They're never, they act as if they are untouchable, that their determinations are God's truth and shall not be questioned. This is scientism. We got a good, healthy dose of scientism with Anthony Fauci, but it is the same thing going on almost word for word when you listen to the gentleman speak to the press lately.
Yeah.
That for ABC News, I think that hasn't gone so well. And one might say that if you're going to have an opponent in this space, um, speaking of theology again, it's as if God made us a gift with that particular gentleman advocating these positions. But whatever it is, there's a culture there that their analyses and decisions shall not be questioned. And this was the essence of what happened here, I think. I speculate based on the fragments of information. By the way, I'm not speaking on behalf of the CDC, the ACIP, or the US government. These are my opinions. Just going to get that out there. But what I think I saw and I'm seeing is that Bobby called in Susan Monarez and said, I want these people gone. And she has made statements. I can't cite book, chapter, and verse, but she's made statements to the effect that she would not fire, in her confirmation hearings, that she would not fire any of the basically senior executive service and established bureaucracy, federal employees within the CDC. And Bobby was saying, these people have to go.
Yeah.
And Susan was saying, no, I'm not going to fire them. And so she had the opportunity to seek new employment, which she then said that, well, Bobby doesn't have the right to fire her. She was Senate confirmed. By the way, that's relatively recent, that Senate confirmation. And so he doesn't have the right, and President Trump hasn't done it. He would have the right. And so her attorneys came out with a statement on X that she hasn't actually been fired and that was illegal. And the president and his staff put a nail in that coffin by saying, well, we've now fired her.
So the entitlement. Not only do they think that they have carte blanche to tell you what to do with your children, but that they can stay in that position of power as if it is somehow owed to them, as if they deserve it.
Yeah.
I mean, I echo what you say. I think it was Sun Tzu that said, never interrupt your enemy when they're making a mistake.
Precisely.
And so I think that we're just letting Dr. Dimitri do his thing. I don't think that very many parents are going to take seriously recommendations about medical products from a so-called doctor who can't even define what a woman is, who calls them pregnant people instead of pregnant mothers. We'll just let him do his thing. Meanwhile, the Maha base, this is actually the $1 million question that I want to ask you, Dr. Malone. Going back to the beginning of the show, that Truth Social post from President Trump where he's asking this question. I mean, I have so much respect for this man asking this question and asking it publicly, saying, listen, Pfizer has shown me data and it looks exceptional, but why don't they show this publicly? Let's investigate this. What is the data? Was this vaccine effective? Is it safe? Give me all the information about it so that we can understand what really happened here. If you, Dr. Malone, had 5 minutes with President Trump, how would you answer his question for him?
Well, essentially, in the appearance is, by the way, that he has been given let's say, a subset of selectively reported information from the vaccine manufacturers. That's, if you unpack, I think that's what I see, is his growing awareness that he may not have been told the whole story. And you mentioned the country western singer event, but here in my part of Virginia, I have some very influential conservatives, some of whom were in the prior administration, that live nearby, and we get together and talk from time to time and often have dinner. We call it the Quarantine Club. And, we're the resistors to the quarantine.
Yeah, we had the same thing.
And good for you. So some of those, the folks that run CPAC, have discussed their own experiences and reservations concerning these products with the president. Matt Schlapp and Mercedes Schlapp in particular. And the president has heard them and been taken aback a little bit. Like, for instance, Matt never took the product. So I know that he has heard this messaging, and I know that he's heard this messaging from his family. But as you say, we talked at length about what it would take to get the president to shift on this topic. And the consensus was Donald Trump, like most politicians, does not look back and reconsider prior decisions. It's bad politics. You just don't own, and particularly with Donald Trump in his position, he is not somebody historically that second guesses himself, putting it gently. And as you point out, for him to take this move is exceptional. It is brave. It is bold. And you ask, well, what would I say to President Trump? And the answer is, I will give my information to President Trump in the context of the ACIP COVID Working Group report, together with my two colleagues, on September 18th and 19th. So stay tuned. And it's the preliminary report. We are having, we had a conference call this morning. We're going to have 4 subcommittee meetings between now because of all the obstructionism that delayed this for 7 weeks. We've got to jam everything in because Bobby is dug in that we are going to have an ACIP meeting in the end of September. So there it is. And what's going to come down is some preliminary comments and recommendations. We are very sensitive to the fact that that underlying all of this is the issue of informed consent. And if we're going to, for instance, recommend certain policies regarding vaccination to COVID for pediatric cohorts and insist that physicians provide informed consent, then we have to give them, we owe it to those physicians to have the documentation and a roster of things that we believe must be conveyed to the parent in the context of an informed consent transaction. So we don't have time to be as comprehensive as we would like. This committee will be ongoing for the rest of this administration, unless some Senate people manage to get Bobby out of there.
Not a
I don't
chance.
think that's going to happen.
Not a chance.
Yeah, and I think, frankly, one of the subtexts to that post on Truth Social, underlying it is the president's endorsement of the secretary.
Yes,
that's one of the most important things there. But
yes,
so we intend to provide our fellow physicians with the information that they're going to need in order to ensure that they give truly informed, they can have that transaction with their patients one-on-one that truly inform those patients of what the potential and documented risks are.
Yeah. And that, you said, will be September 18th and 19th.
Yep.
And that will answer President Trump's question. He will be able to then have not just comprehensive information. He'll be able to have a bullet point of arguments either for the efficacy and the safety of the vaccine or against, based on not particular people with profit motives selling their product to him, but based on science and observation.
And we, in the subcommittee membership, we are incorporating people. The current thinking is we will have some members that come from the prior subcommittee that are advocates in favor of the product. Our mission, despite what the press says, I don't have a preconceived decision, and I know the other members share this. We're in there for the data.
Yeah. And
if the data show that these products are in fact safe and effective, then we we won't hesitate to say so. But if they have, there are aspects where they're not as effective as they've been marketed and not as safe as they've been marketed, we're going to say that too.
Yeah.
And
now we haven't seen randomized controlled trials, against placebos for the COVID vaccine. What's up?
And paradoxically, despite all the limitations of the trials associated with the COVID products, they are among the more rigorously tested compared to some of the other vaccines on the childhood schedule. Now, that's another thing that's going to happen, is that there's another subcommittee that's looking at the entire pediatric vaccine schedule. And one of the issues right now with the COVID products is we've had various decisions coming down from the FDA about authorizing these products now that they're no longer protected by emergency use authorization. And we've asked the CDC, we've asked, Tony Lyons. So
shout out.
we have asked the FDA to share with us the data that they used to justify those decisions. Now, in various public statements, the FDA, Vinay Prasad has basically said, we don't have the data. So let's hope the data are forthcoming, but we do. I'll give you a little read ahead. This is probably out on a limb, but the FDA liaison to the ACIP, who works for the FDA, is a very experienced epidemiologist. I'm not sharing non-public information to say that this is Tracy Hogue. She's very skilled in data analysis and understands the VAERS, has been working with the VAERS, worked closely with Dr. Joe Latipo down in Florida to analyze the Florida data that we've heard so much about. And particularly, for instance, the comparison between Moderna and Pfizer that has been a little bit of a shocker. And she is busy diving into VAERS, and I won't give you the full punchline, but pay attention for her analysis as it gets disclosed in the end of September. I think that
I was just going to say, will that come at the September 18th date as well?
That's the intention.
Okay. So, and is it plausible for us to expect, as a result of, I guess, particularly not even the COVID vaccine, but the childhood schedule, all those different vaccines, is it plausible that the CDC recommended schedule could change, that some vaccines could be recommended for removal by ACIP to the CDC director, dependent on data?
And the gentleman that you referred to in his ABC interview, I don't know why, decided to open the can of whoop-ass about the hepatitis B vaccines for the newborns. And we had Ron Paul, a physician, come out and directly contradict him about the justification for hepatitis B vaccines in newborns. That is a particular hot spot. It is very hard to justify that decision. And I imagine that will be one of the early ones that will be examined. There's also the policies regarding the human papillomavirus vaccine and when that is administered in the childhood schedule. With hepatitis B, it's particularly egregious because the justification is, well, mother might have hepatitis B. Well, every single birthing mother, yes, female, in the United States, bar none, gets tested for hepatitis B infection. Okay, so that is, the idea that we have to have universal hepatitis B administration to newborns because of the risk of mom transmitting it, when we already know which moms, a very small number of moms have hepatitis B that place their newborn at risk, and those ones could be potentially vaccinated. So that logic just fails. Furthermore, the Another thing that's almost never discussed regarding these vaccines is, here's a key term in vaccinology for everybody to remember: durability. What is durability? We all know about durability with COVID vaccines because it stinks. That's why they want you to have a booster every 3 months or whatever the latest number is because the protective effect is very transitory. And then, according to some studies, you end up in, you said it, negative efficacy, where you actually become more susceptible to the disease at some point after vaccination than you would have been if you'd never took it in the first place. So that's true with various products that are almost never discussed.
Yeah.
And hepatitis B titer only is maintained for about 6 years. So by the time baby Jane is at risk for hepatitis B in any significant way, if she decides to become an intravenous drug abuser or a sex worker, using the approved terminology, she's already lost her neonatal titer from the initial vaccination. So part of the logic there with Hep B is, well, we got to jab them early because we might not get them later on. They don't come back when they're teenagers. And, well, by that time, the titers petered out anyhow. So the whole logic of hepatitis B just falls.
It's just so egregious. When my oldest daughter was born in the hospital, I declined the hepatitis B vaccine on the day of her birth. And I already knew I was going to do this. And you fill out a form when you go to give birth or before you give birth, so they know those things. But when I declined that day, they asked me anyway, even though I had already previously said that I was going to decline. And the nurse, when I declined, was just like, okay, walked out of my room. Well, they sent a neonatologist about an hour later into my room to pressure me to give this vaccine to my daughter. And I said to the neonatologist, I said, well, why does she need this vaccine? I don't have hepatitis B. And the neonatologist was like, well, you could get in a car wreck on the way home and your infant daughter could be injured and need a blood transfusion, and that blood could be contaminated with hepatitis B.
That's a major fault. Then somebody sues the blood bank. In terms of blood bank policy, that should not happen.
Listen, you know how sometimes when you're in a scenario and you don't think of like the perfect thing to say until that scenario has already passed, like later that day, you're like, oh, I thought of the perfect line. I told my husband, I was like, I get an excuse because I had just given birth, but I wish I had had the wherewithal to ask this woman, how many times a year does that exact scenario happen in the United States? Because I am positive the number is 0. And yet they were trying to coerce me into giving my daughter this vaccine that she didn't need, even after I had declined 2 different times.
Apparently, another justification is that you might have your child get bitten. Bitten by another child at some point in time who might have hepatitis B. And apparently, in the entire United States, historically, there may have been 2 cases of that, just to your point. So for this, we justify jabbing every single newborn.
Yeah, it's sad, actually. And listen, I'm so grateful for President Trump. I'm so grateful for Secretary Kennedy for actually asking these questions and allowing the public to have these discussions and search for this data, because wherever the data leads, I think that the militant pro-vaxxers would be very surprised at how open-minded we are, that we are actually letting the data drive our decisions and drive our opinions, that we're not ideological about it the way that they are. But the media stranglehold on shaming and ostracizing anybody who questioned any directive from a public health official, that era has come to an end. And I'm so grateful for that.
It's turning. It's turning slowly, but it's turning.
It is. And I appreciate all the hard work.
Base are pretty angry that it's not turning faster. And
Me too.
Bobby has a magic wand and he can just say, make it go away. But you can.
Doesn't he?
You can, he has taken some serious heat. I said to one journalist the other day that was pestering me, and of course they all hate me almost as much as they hate Bobby. But I said, I think Bobby should get a Purple Heart for what he's taking as incoming, and it
Yeah.
doesn't seem to bother him. He's bulletproof. It just bounces off, and that'll continue to be the case so long as the president has his back.
Yeah. Yeah. And I think not to be so presumptuous as to speak for Maha moms here, but I am a Maha mom. And I think that we feel an incredible amount of urgency because, 9 months is a long time. They've been in office almost 9 months, 8 months, I
Yeah.
suppose. And they get a very limited amount of time. They get 4 years. And we know the left sets traps and we know that industry is powerful and has deep pockets. And we didn't vote for incrementalism. We want these paradigm shifting changes, not just because we want the political win, because these are our children.
Yeah.
This is our children's health and well-being and safety. And we feel that this is a once in a generation, a once in a lifetime opportunity for justice for these children and to hold these not only government bureaucrats, but these industry titans accountable for the incredible harm that they have inflicted on our country.
Your point, and another Substack that apparently nobody, it really hadn't been publicized. There was a leaked memorandum from the industry organization called BIO. There's two big industry organizations, BIO and Pharma. And so BIO has a war chest of about $4 million. And a memo came out that they were going to expend $2 million on trying to get Bobby fired. And in terms of the timelines, they wanted to have that done by the end of September. So all of this media push and all these influencers, and specifically they said they were going to pay conservative influencers to attack Maha and attack Bobby. And so some of these people that you're seeing spouting off, Bobby is less than perfect memes and narratives are working for the bad guys.
Yeah. And I've been a part of the Maha movement for a long time, and that has translated into I have some contacts inside the HHS. Let's just say that. And I communicated to them that Maha moms are not frustrated and ready to drop Bobby. It's the opposite. We are pit bulls on leashes waiting to defend Bobby against unfair accusations by industry and mainstream media smears once he unleashes the paradigm shifting changes. We are put us in, coach. We are waiting. This is what we've been living for. So we are here. We are ready for it. One last question before I let you go. The Daily Beast, this is about a week and a half ago. The Daily Beast had a report that the COVID vaccine, that ACIP was perhaps going to recommend that the COVID vaccine be removed from the market entirely.
He didn't even say ACIP. He said, so this is Asim Malhotra, the cardiologist from Britain, gave an interview to the Daily Beast that, let's say gently, was not authorized.
Yeah.
And he did not receive any coaching prior to that. And I consider Asim a friend. But I've been on tour with him. I've watched him. I've spent a lot of time in the UK. I've spoken at rallies with him in the UK. And he brings a lot of value into this as a cardiologist, much the same as Peter McCullough. With a history of talking about SSRIs and other things, his father passed away in a way that he attributes in part to the mRNA products. And he decided to come out to the States. I don't know why. And he is associated with, that was Sonia Kellick of Epoch Times. So he is associated with Maha Action. And let's infer that he was naive about the nature of the Daily Beast. If he had HHS comms or Tony Lyons, if he had sought their counsel or my counsel and said, "Hey, I want to do an interview with Daily Beast. What could possibly go wrong?" I would have said, "Do not do that. You might as well go talk to the New York Times or the Atlantic Monthly, and bring your 45 so you can shoot yourself in the foot while you're doing it." So I'm sorry that my friend felt the need to make those statements at that point in time which were amplified by media. I wrote to him. He proudly sent me the article, and I asked him, "What are you doing here? Do you know what you've done?" And then the downstream, wrap up smear articles came out, and that was another part of the fireworks of last week, as if things weren't complicated enough. So Asim made these statements, and then 3 days later, Bobby announced the termination of the EUA, which I had known was in the works. I'm gonna do this. Hey, Jan, I'm on an interview.
He's a very popular man.
It's been a 3-ring circus. Asim, in my communications with him, indicated that he thought this was a very good thing. It rallied the base. Other people disagreed with that. He has the right to free speech here in the United States, not so much in his native UK.
Yeah.
And he said these statements, and I prefer that he hadn't done that interview with the Daily Beast. And I'm not going to make any comments about what motivated him or what the agenda seemed to be, but he did it. And he was contradicted by the secretary within a couple of days. And I trust that he has learned another little lesson about media and propaganda in the United States, which has different rules of engagement than it does in the UK, particularly consequent to Sullivan versus the New York Times, where it essentially established that if you're a public figure, the press can libel and slander you at their heart's content, and there isn't a darn thing you can do about it, unlike in the UK. So it's not fair, it's not nice, and it's just the way things are. And Asim got an unpleasant lesson in American media, I think, that I hope he learned from.
Yeah, I think that report riled up a lot of people. On both sides. I think it did provide a little motivation for Maha, but we all operate here. We're fed by the truth, not by rumors here. We're looking forward to your reports later this month, September 18th. We'll be tuned in. We'll hope to talk to you again. Guys, if you do not already follow Dr. Malone on X, he is a fantastic follow. Also subscribe to his Substack for even more in-depth information. We've been talking since probably the beginning of COVID. And he's really been a warrior for the truth. So I appreciate you, Dr. Malone. Thank you for being on the show today.
Thanks for having me on, Liz. And, keep strong, carry on.
Thank you. Will do. All right, guys, I got a question during the show last week about my criticism of Big Pharma. Someone said, if you criticize Big Pharma so much, how can you advertise for All Family Pharmacy? Because they're selling pharmaceutical products. And I said, well, yes, but that's not the same thing, because being opposed to Big Pharma doesn't mean that you're opposed to every single product that Big Pharma has produced. You're opposed to the corruption. You're opposed to the coercion. You're opposed to the profiteering and the harm and the lies. It doesn't mean that you're opposed to individuals being able to make choices about their own healthcare. Sometimes you need antibiotics. I try not to take them because it wrecks your gut microbiome, but sometimes you need them. And when you do, you don't want doctors telling you no, or your insurance denying you a certain care or mandating that you do something that you don't want to do. You want to be able to have access to the medications that you need that actually work for you. That's why I'm proud to partner with All Family Pharmacy, because they are a patient-first, independent pharmacy. They connect you with licensed U.S. doctors who approve your prescriptions online, fast, and legally. No gatekeeping, no insurance middleman, no red tape. They offer affordable, high-demand medications that are often hard to access, usually for political reasons, like ivermectin, for example. At All Family Pharmacy, you can get ivermectin starting at just $2. Medbendazole, hydroxychloroquine, antibiotics, NAD. It's so easy. You order online and it takes you just minutes. Then a licensed doctor reviews and approves your prescription. Medications are shipped straight to your door, so that means no clinic visits, no hassle. Everything is done securely. It's HIPAA compliant. It's pharmacist reviewed. You choose the medication, not an insurance company or an indoctrinated physician. Real healthcare freedom means you decide what's right for your body. That's why All Family Pharmacy offers transparent pricing, no surprise bills, why they're trusted by thousands of Americans who are taking control of their health. It's time to put your medical freedom back in your hands. Visit allfamilypharmacy.com/Liz. Because you are part of this MAHA movement, you can use my code Liz10 at checkout for an exclusive discount. It's your health. It should be your choice. That's allfamilypharmacy.com/Liz, code Liz10. So what happens when you have a health event, when you get injured, when you have a medical bill that you need to pay for and you have to deal with insurance? Or what's your alternative, that you don't have insurance at all and you pay for it out of pocket? Well, what if I told you you could get healthcare for under $100? You've heard me talk a lot about Crowd Health because my husband and I quit our health insurance almost a year ago. It was last November. We said, listen, we're paying these extraordinarily high premiums. Our deductible is unreachable. When we do have a medical event, it's not covered. Claim denials are a story all of us have dealt with. We want to manage our healthcare better. There has to be a better way. And so we signed our family up for Crowd Health. Today, I want to tell you about something new that Crowd Health just introduced. You can finally rid yourself of the bureaucracy of the healthcare system and take agency over your own health. Crowd Health just introduced what they're calling the Black Swan membership. It's the healthcare alternative for people who want autonomy over their care, their costs, and their lifestyle. They just need a little help with the Black Swan events that do happen in our lives. For just $95 a month, you get access to a team of health bill negotiators, low-cost prescription and lab testing tools, and a database of low-cost, high-quality doctors vetted by Crowd Health. You stay in control without insurance and their networks dictating your care. And what if something major does happen to you or to a member of your family? Well, in that case, you pay the first $15,000 and then the crowd, that's me and my husband, my family, and the rest of us, we step in to help fund the rest. It feels like options we used to have before Obamacare messed everything up. And if you use my promo code Liz, it's only $80 for the first 3 months. Visit joincrowdhealth.com. Use my promo code Liz. Visit joincrowdhealth.com. Use my promo code Liz. All right, guys. Quite the information from Dr. Malone. He has an inside seat inside CDC because he sits on the ACIP committee. And it's a very powerful committee that determines or is instrumental in determining what vaccines are brought to the market and what vaccines are recommended, both for children and for adults, healthy adults at large. And September 18th is that day. You know, we'll be sitting here, you and we will be sitting here together when Secretary Kennedy and his entire team unveil the MAHA report. I'm getting chills just thinking about it because I don't like to make a lot of predictions in politics because you're dealing with people. I don't have a crystal ball, but I predict today that there is going to be paradigm shifting changes that are made as a result of this MAHA report. September 18th. Set the date on your calendar. We will be sitting here together as this report is unveiled to the public. Make sure you're subscribed to the show so you don't miss a moment of this. Go to Spotify, search The Liz Wheeler Show, hit subscribe. Go to youtube.com/Liz Wheeler. Although I have to say, for the MAHA report, you might not find that on YouTube. So you might want to subscribe on X instead, x.com/Liz_Wheeler. Or, of course, everything uncensored all the time at blazetv.com/Liz. Thanks for watching today. Thanks for listening. I'm Liz Wheeler. This is The Liz Wheeler Show.